has helped drive a county-wide conversation about the importance of having people know that the vaccine is safe and meeting them where they are. To continue this important discussion, I am so honored that Dr. Anthony Fauci has joined us today. He has advised 7 presidents on global health, and as a trusted and familiar public health leader, I know his voice and insight matter to our residents. With that, I'd like to turn it over to Dr. Fauci for some brief opening remarks before we move to the questions that have come in from our community. Dr. Fauci.
Thank you very much, Ms. Alsobrooks. It's a pleasure to be here with you today. As we all know, we don't have to be informed of the extraordinary crisis that we have experienced over the last year, including those of us in the Washington, D.C. metropolitan area, including Prince George's County. We have had now over 450,000 deaths in the United States and well over 24 million infections. We are still in the middle of an outbreak that, although it is starting to plateau in the sense of looking at the number of cases, we still have a number of challenges ahead. The light at the end of the tunnel is vaccines. We have been fortunate enough that we have made investments in the development of and clinical trials of a number of candidate vaccines that have proven to be highly efficacious with a very good safety profile. Our job now, and really is a task, is to get as many people vaccinated as quickly as we possibly can, because the way you end this terrible scourge that we've experienced over the last greater than 1 year is to get everyone protected, such that we have an envelope or an umbrella or a blanket of herd immunity over the community. And that can only be accomplished by vaccines. So one of the reasons I'm enthusiastic about being with you today is to be able to answer questions you might have on any aspect of the vaccines that are available, the preparations that have been made, and any concerns that you might have. So with that, I'll stop and be very happy to answer questions.
Thank you so much, Dr. Fauci. I will turn it immediately over to Dr. Wright, who will help us to answer some of the commonly posed questions. Dr. Wright?
Yes, good afternoon, Dr. Fauci. We've heard from the community concern about differences between the 2 vaccines that are currently available, and is one better than the other? And what about the Johnson & Johnson vaccine that is in the process of heading to emergency use authorization? There is concern about the vaccine as a single shot, but also apparently less effective than the other 2. Can you address that question, please? Thank you.
Okay, so the 2 vaccines that are currently being administered are what's called mRNA vaccines, one from the company Pfizer, the other from the company Moderna. They have shown in clinical trials of 30,000 people with the Moderna and 44,000 people with the Pfizer trial to be highly efficacious in preventing clinically apparent COVID-19. In other words, to prevent you from getting clinical symptoms. It is 94 to 95% efficacious and a very good safety profile, with nothing really of any great concern, some allergic reactions with people who have a very strong history of severe allergic reactions to the tune of anywhere from 2 to 6 per million. But other than that, the safety signal is fine. The Johnson & Johnson or Janssen one that is right now in the process of having their data evaluated by the FDA, it looks like the efficacy there is not quite what it is with the Moderna and the Pfizer, about 72%. However, one thing about it that is very favorable is that it is extremely effective in preventing serious, severe disease, including hospitalizations and deaths. So although the number 72% isn't as what you might think would be as favorable as 94 to 95%, it still is value added and would be a very good addition to our armamentarium of vaccines, which we will have. So we hope they get their EUA, and if they do, I think it would be a very important addition to the vaccine profile that we have now available to us.
Thank you.
Good afternoon, Dr. Fauci. It's an honor. This vaccine has been developed so quickly. How do we know that it's safe and effective?
Well, that's a great question. And that's, I'm glad you asked it because it's asked often. The speed with which we went from a realization of the genomic sequence of the virus on January 10th of 2020 to the time we had a phase 1, phase 2, and then a phase 3 trial, to the point that we actually were putting vaccine into the arms of individuals by the end of December of 2020. That speed was not a reflection of cutting corners. It was a reflection of the extraordinary advances that were made in the science of vaccine platform technology. And as a matter of fact, that work had been going on for about a decade before the virus was actually recognized. So although it seems that it was cut short with regard to time, in fact, the advancements were purely reflective of scientific advances. So people should not feel that the speed is a negative. The speed is a very positive thing because it reflects extraordinary advances in science.
Dr. Fauci, perhaps the most common question that we're hearing in the community, is it possible to get COVID-19 from the vaccine?
Well, the answer to that question, Dr. Wright, is absolutely no. It is impossible because what you're being injected with is a messenger RNA that codes for a single protein, the spike protein of the virus. It's not like a live attenuated virus where you actually inject the virus into the person. The virus is not in anywhere near in the situation of getting into the person who receives the vaccine. What they get is a coding sequence to code for a very specific protein. So the short answer to your question, it's impossible to get COVID-19 from the vaccine.
Some of our residents ask about getting the flu shot. Some of them never get it. They ask, why do I need to get this flu, to get a shot?
Well, I think the numbers are answering that question. There have been now 440, close to 450,000 deaths in the United States due to COVID-19. Particularly susceptible are African Americans and Latinx, who have a much higher rate of infection, hospitalization, serious consequences, and death. So the good reason to get vaccinated is to protect yourself, to protect your family, and to protect your community.
Dr. Fauci, there have been many reasons expressed for vaccine hesitancy. One of them is a mistrust in the medical system due to the history of the natural experiment known as Tuskegee around syphilis, and also the biologic exploitation of the family of Henrietta Lacks. How can we be reassured that the vaccine is not negatively targeting communities of color?
Well, the concern on the part of brown and black people about engaging in a program, a medical program that is run by the federal government, is understandable. And I think the first thing we need to do is to respect the concern of people of color who have hesitancy, but on the same time to explain to them that the ethical safeguards that have been put into place since Tuskegee and since the Henrietta Lacks incident are such that those types of things would be impossible under today's conditions. You cannot get a clinical trial done unless it passes very strict ethical review. So right now, we need to inform people in the minority community that vaccines or any other intervention are under very close scrutiny by ethical boards, as has been the vaccine program for COVID.
Dr. Fauci, there's a rumor going around in the community that the vaccine works because it changes a recipient's DNA. Is that true?
Oh, absolutely not. The vaccine has nothing at all to do with modifying your DNA. It's an mRNA that codes for a protein, and your body will make a response against that protein. It's a very commonly asked question, understandable because they hear the word messenger RNA, but it has nothing at all to do with your own DNA.
Dr. Fauci, the recent passing of high-profile people like Hank Aaron has sparked rumors in the community that the vaccine is killing people. Is the vaccine deadly?
Well, absolutely not. In fact, there are very close follow-up to see if there's any association between the vaccine and any other deleterious events, including death. And this vaccine has a very good safety profile and did not kill Hank Aaron.
Dr. Fauci, many people wonder, why do you have to continue wearing a mask after they've been vaccinated?
Well, that's a good question. What we know from the clinical trial is that the vaccine prevents you in 94 to 95% to get what's called clinically recognizable disease. It is conceivable that the vaccine can prevent you from getting clinical disease, but you still might get infected without any symptoms. If that is the case, it is conceivable that you have virus in your nasopharynx, and even though you're protected from disease, you might inadvertently spread it to someone else. So the purpose of wearing the mask is to prevent you from spreading virus, if you happen to have it in your nasopharynx, to someone else. As the months go by and we get more information as to the efficacy of the vaccine in actually preventing true infection, not just clinical disease, then there might be modification of that recommendation. But for now, just to be sure, we recommend that even though people get vaccinated, that they continue to wear a mask.
So Dr. Fauci, what happens if I wait and don't take the vaccine until later in the summer?
Well, then you're putting yourself at an extra risk. And that's the reason why we tell people when the vaccine becomes available to you, please take it and don't wait, because every day, every week, every month that you delay, if you have it available to you, you're putting yourself at risk for getting infected with this very difficult virus, as you know, that's killing so many people.
So Dr. Fauci, how long does it take for the vaccine to start working?
Well, it starts working moderately, not optimally, about 10 days to 2 weeks following the first dose. You get optimal protection about 10 days to 2 weeks following the booster. And as you know, with Moderna, the booster is 28 days later. And with Pfizer, the booster is 21 days later. So about a week and a half to 2 weeks following your second dose or your boost, you get maximum protection.
So Dr. Fauci, if others around me are getting vaccinated, do I really need to?
Yes, because it depends on what you mean by others around you. There's a thing called herd immunity, which when maybe 85% or so of the population gets vaccinated, it brings the level of virus very low in the community to the point where there's sort of an umbrella of protection for everyone. But until that point, everyone should contribute, not only to protecting yourself, but there's a secondary benefit. You can be part of the effort to protect the community, including the vulnerable people who, for one reason or other, the vaccine does not have a good effect on them, such as people who are immunosuppressed and may not make a robust response against the vaccine, against the virus, that is.
Will the vaccine be effective against the new COVID-19 variants?
Well, it depends on the variant. The one that is now in the United States from the UK, the vaccine looks like it's very good against the B117 variant. It is somewhat less effective against the South African variant, but nonetheless, it still falls within the range of protection. So we feel it is quite good against the UK variant. And although there's some diminished protection against the South African one, it likely would still protect.
How do I know there won't be long-term complications from the vaccine?
Well, that's a very good question. If you look at the history of vaccinology, essentially all of the so-called long-term adverse events occur within 45 days of your last dose. And for that reason, the FDA does not allow a vaccine to be used on emergency use authorization until 60 days following the time when half of the people get their last dose. So people don't fully appreciate that you can't even get a vaccine on an EUA until you've waited 60 days after the last dose in the clinical trial. So that means that you've covered well over 90+% of all the possibilities of there being long-term effects.
Dr. Fauci, what are the most common side effects and how common are they?
Well, I can tell you from my own experience, because I think I had what's called a prototype experience. After the first prime, my arm hurt a little bit. If I pressed on it, I felt the little ache in the arm. Went to bed at night, woke up the next morning. It lasted maybe into the next day, but by the time of the nighttime of the second day, it was gone. A little bit different with the boost. With the boost, which was 28 days later for me, again, I had a little bit of an ache in the arm, but towards the evening, I started to feel a bit fatigued, maybe a little lower back muscle ache that made me feel not 100% normal. It didn't prevent me from coming to work. I did everything I do normally on a working day, went to bed, woke up, it got a little bit better the next day, and by the following night, I was back to 100% normal. So for about 24 hours, you may be fatigued, you may have a little muscle ache. Unusual to get fever, but it has occurred in some people. I did not get fever, but some people do get fever.
And to that end, Dr. Fauci, why do we need to take a boost?
Well, in order to get the maximum response, we know clearly that you get some response after the primary, but the maximum response, for example, the level of neutralizing antibodies after the boost is about 10-fold greater than what it is following the prime. So you get a very good benefit from getting the boost.
Dr. Fauci, is it true that there's not enough doses for everyone to get a second? And should I go ahead and get my first dose anyway?
Well, you definitely should go ahead and get your first dose. There's not enough to give everybody in the country a prime and a boost right now. But as we go from February to March to April to May, there'll be many, many more doses available. So our recommendation is when your turn comes up, get your prime, and I'm certain you'll be able to get your boost also.
Dr. Fauci, I'd like to thank you for taking time to address questions from our community. This has been immensely informative and helpful for all of us. And I turn it back to Madam County Executive to close us out.
All right. Thank you so much to Dr. Carter, Dr. Wright, for guiding this conversation. And to you, Dr. Fauci, thank you so very much for taking time to join us this afternoon. We are most grateful. We are not only grateful for the work that you're doing, but we're grateful also for your commitment to science and to facts and doing all that you can to end this pandemic. I'm pleased that many of our residents were able also to listen to this today. And we're going to make sure that as many of our residents as possible have the opportunity to hear this conversation and your answers. Please know that we are right next door and we welcome you back to Prince George's County at any time. And to our residents, I hope this conversation has helped you understand more about the COVID-19 vaccines. As all of the doctors have said today, the science tells us that these vaccines are safe and effective and really do protect us from COVID-19, but only if we take them. When we take the vaccine, it not only protects us, but also our family, friends, neighbors, colleagues, and those with whom we worship. When your turn comes, I encourage you to sign up to receive the vaccine so you can join us in being proud to be protected from COVID-19. If you want to learn more about the vaccines or pre-register to receive a vaccine appointment, please visit mypgc.us/COVID vaccine. Thank you again to Dr. Fauci, Dr. Wright, and Dr. Carter. May God continue to bless everyone who's watching today, and may God bless Prince George's County. Thank you so much, everyone.
Thank you. Good to be with you.
Thank you.
Congratulations to the Tampa Bay Buccaneers. Would have liked to see a New York team in the Super Bowl, obviously, but that did not happen this year. Next year is a different story. It was an amazing game, and what's right is right. Congratulations to the Tampa Bay Buccaneers. They won big, they deserve it. Mr. Tom Brady, who has long been a nemesis to New York teams. He played with the New England Patriots, and we had a great New York rivalry with the New England Patriots for many, many years. And he is smart and talented and is going to go down in the history books just as an undeniably great player and a great team. Gronkowski, it's a fun game to watch, but there's next year, and we look forward to next year. Meanwhile, we're focusing on our three priorities, three tracks, right? You have to walk and chew gum at the same time. Government has to operate on multiple levels now, and it has to operate well and efficiently and produce. Control the COVID spread, vaccinate New York, reimagine, rebuild, renew, which is the reopening. All three tracks must continue simultaneously. On COVID spread, COVID numbers are down. Congratulations to New Yorkers, because their behavior, their actions, their responsibility, their discipline, their sacrifice is what brought the COVID numbers down. Positivity rate 4.2%. Statewide deaths 114. There are no thoughts and prayers. Hospitalizations plus 67. ICU down 5. Intubations down 18. Long Island has the greatest hospitalization rate, not dramatically higher, but higher. And we've been seeing this for the past couple of weeks. Highest positivity, Long Island and Mid-Hudson. We've been seeing this for the past couple of weeks. Again, it's relative. All the numbers are coming down, but we focus on the highest numbers in our state. In New York City, highest number is the Bronx, and getting higher. So the Bronx is a problem. We opened the Yankee Stadium mass vaccination site, but the Bronx is still a problem. The numbers, 4.4 on the 7-day average, is way down from where we started. The post-holiday surge is over. We see it in the positivity, we see it in the hospitalizations, and we respond to the data. We respond to the facts that we face today. Facts may change tomorrow, and then we will change with the facts. The enemy changes tactics, we adjust with the enemy. But the numbers are down now. We were planning to open the restaurants in New York City 25% indoor dining on Valentine's Day. They have made the point that they'd like to open a couple of days earlier so they can be ready for Valentine's Day, get the staff oriented, get supplies into the restaurants, and that's a reasonable request. So we'll start indoor dining on Friday at 25%. That will go into effect on Friday. They can go to 25% on Friday, and they'll be ready for that weekend and for Valentine's Day. Crossing out Valentine's Day is not really accurate. Valentine's Day, it should be a big restaurant day, and but we'll open 25% indoor dining New York City Friday before Valentine's Day, so they'll have a big Valentine's Day. We overall are in a foot race with the COVID spread. We're watching for variants. We're watching for increased infection from variants. We're watching vaccine effectiveness with some of these new variants of interest, as they call them. But the foot race is clear. It's rate of vaccination versus rate of infection. Vaccinate, vaccinate, vaccinate. Overall, statewide, 2.465, updating at 11:15. Obviously, that didn't happen. We're at about 90% of all doses allocated used in arms, and it's only Monday. right? So we get an allocation during the week, Monday, Tuesday, Wednesday, Thursday, depending on location. You'll get deliveries Monday, Tuesday, Wednesday, Thursday. It's Monday, we're already at 90% in arms. And this is what I've been trying to communicate. We get a supply on a weekly basis. It comes in Monday, Tuesday, Wednesday, Thursday. It's Monday, already 90% of that allocation is done. So we go week to week. By the end of the week, we basically exhausted the entire week's allocation, and then we wait for the next week's allocation. What has been helpful with the Biden administration is we know what we're going to get for the next 2 or 3 weeks. So at least we can plan and we can tell the local governments, this is the number you're going to get next week. You don't have it yet, but this is what you're going to get. So it has smoothed out the scheduling, but it's still week to week. We have a much larger distribution network than we have supply. We have many more distributors than we have product on the shelves. That's the tension that we're facing. And that's why you have so many people chasing vaccines every week and vaccine appointments. But at one point, the supply will increase, and we want to be ready when that supply increases. We have prioritized healthcare workers, doctors, nurses, our frontline heroes. We've focused on hospitals administering to those nurses and doctors. They're exposed most. They would be super spreaders if they get it. And if they get sick, the hospital capacity comes down. We went from 63% on January 18th. We made a big push. We got to 72%. Between the 25th and today, we're at about 75%. So we're really hitting the refusal rate or the maximum rate that these hospitals can get done. Since we are at that maximum peak number, there are still hospitals that are slower than other hospitals, which I'll mention in a moment. I've told the local health departments for weeks to get after those slow performers. But we're going to take the excess allocation from the hospital workers and use it for people with underlying conditions, comorbidities. This week, they have the vaccines to vaccinate their workers and finish, but this is it. It will have been over 2 months that they had the vaccine for their hospital workers. And they were charged with the responsibility of making sure every hospital staff person who would take it has taken it. Hospitals can't say to a nurse, you must take the vaccine. The nurse has the right to decline. But I want to make sure every nurse had the option, every doctor had the option to take that vaccine. If they don't want to take it, at one point we understand and we'll give it to somebody else. So this is the last week for that. There is still a gross disparity in the high-performing hospitals and the low-performing hospitals. And again, I asked the local health departments to look into this. But how do you have some hospitals at 100% and some hospitals at 40%, 50%? Something is just not right somewhere. I've been on the calls with the hospitals myself. I understand that there's a declination rate. I understand that there may be, that there are racial differences in declination rates. I get that. But it still doesn't add up in my book, because you still have some hospitals in the same region with the same demographics of the same workforce, and you have a gross disparity. So the New York State Department of Health is going to review those slow vaccinating hospitals. We want to understand why and how, but we're also going to use the excess supply for those with pre-existing conditions. That will start on February 15th. We have a list on the website of what the comorbidities are. That's basically a clarification of some of the specifics of the federal CDC guidelines. And these will be statewide regulations defining comorbidity for any site in the state. People with comorbidities can begin making appointments on the state sites February 14th to open February 15th. On the local health department sites, the appointments can start on the 15th. We'll leave it to the local health departments about when they start scheduling, but they can't schedule an appointment to be performed before February 15th. Local health departments want to coordinate with their hospitals, with their local doctor networks. That is up to them how they do that. You do need, this is for people with comorbidities as defined by the CDC and state guidelines. And the state guidelines are just a refinement of the CDC guidelines. There will be validation of the comorbidity. People will need to bring a doctor's letter or medical information that evidences that they have this comorbidity, or they now sign a certification when they get the vaccination. They'd have to certify that they have a comorbidity. Those three options are all available. We'll leave it to the local health department about to determine what exact validation they want, but they have to validate. And the state will audit the local validation system in coordination with a system called Tiberius, which is the federal data system that we all signed on to that actually documents where the doses went. This is a precious resource. There will be fraud, there will be mistakes, there will be inefficiency. We understand that. But we will also audit to make sure the rules are followed. New Yorkers are fair. If you have a comorbidity, they get that 94% of the deaths are people with comorbidities. They also understood the prioritization of nurses, doctors, essential workers. So New Yorkers are fair-minded, and everybody wants this vaccine. But the rules should be followed. We don't want people abusing the system. New York State Department of Health will do a call with the county executives, local health departments to talk through and explain the comorbidity validation process. But it is still clear, and let's just understand the scope of where we are. We need an increase in the federal supply because we still have many people chasing a very rare and precious resource, the available doses. The Biden administration has increased the federal supply. Again, they're not making it in the basement of the White House. They're buying it from the drug companies. We understand that. But they are the only ones who can buy from the drug companies. So really, they control the spigot on the supply. They've increased it over 10% already in just a few weeks. And they have told us what the future allocations were, as I mentioned, which really helps our administration. But we need more. And I said on day one when this started, everyone is going to say the same thing. I need more. Every governor in the United States will say, I need more. Every county executive in this state will say, I need more. Every politician will say, I need more, and we should help this group and this group and this group and this group. I get it. Everyone understands the dynamic, but you have a precious resource, and only Jesus could figure out how to feed hundreds with limited loaves of bread and fish, right? So we need to be fair in the allocation until the supply increases. What could make a big difference in the supply? Johnson & Johnson. They filed for emergency use authorization. That could be a game changer. Single dose, no super cold, refrigeration chain needed. That could make a major difference. So we need that major difference. We need that bump in the supply. Second doses now are allocated by the federal government. Here's your first dose, here's your second dose. The Biden administration is against using the second dose for the first dose. They're against delaying the second dose. Obviously, we follow federal guidance, and we have the added luxury of actually partnering and trusting this federal government when it comes to the professionalism. So we're following the federal guidance. There is still a question on excess doses. There's a long-term care facility program, the program that does nursing homes through pharmacies, et cetera. There will be excess second doses. Some people will not come back for their second dose for one reason or another, but there will be some fall off. We want to make sure we're using every dose. So excess in the nursing home program, or excess in the pharmacy program, or excess in second doses where people don't come back. How do we reallocate and use those? And those are issues that we're working through with the federal government. But the bottom line, which is the bottom line on this slide, you have 15 million New Yorkers who are ultimately in need of the vaccine. The supply is still about 300,000 per week. That takes 1 year at this rate. 1 year. So just a sober note, but also a realistic note. Well, why don't I get a vaccine today? Why don't we do all the police today? Why don't we do all the teachers today? Why don't we do all the developmentally disabled today? You don't have the supply to do it. And if you want to prioritize someone, well, then you have to deprioritize someone. We have 15 million total population. We have about 10 million now currently eligible. Well, I think we should add this group. Okay, then tell me who you want to take out. You prioritized nursing homes. You prioritized nursing home staff. You prioritized nurses and doctors and police. Who do you want to take out if you want to add someone? These are all difficult decisions. But you need an increased supply because you will have months and months just to get to the people who are now eligible, okay? And that's just a fact that we have to keep in mind. At the same time, multiple tracks. Keep the COVID spread down, get the vaccinations going, and at the same time start to reopen the economy. You have to rebuild and renew this economy. Yes, the vaccine is a light at the end of the tunnel. There is no doubt about that. But we have to create that light. We have to make it happen. It's not going to be a situation where the economy will just come back. We have to make it come back. And we have an opportunity because COVID caused a global crisis. You have states all across this nation, you have cities all across this planet that went through this, and the question is going to be who adjusts to the new dynamics fastest and best. And there's an opportunity in that. Whatever economy most quickly adjusts to the new dynamics, that will be the economy that thrives the most, right? So, step one, we need Washington to actually provide state and local relief. President Biden has promoted it and proposed it with $350 billion in state and local aid. House has agreed, Senate has agreed. Now the question is going to be the fairness in the distribution of the $350 billion. And our point is, I know the federal government wants to help many sources, but provide the state with state relief that it needs so we can balance the needs in this state. And our needs are $15 billion. Fairness also means repeal the unfair SALT assault, which when the Trump administration passed the SALT tax proposal, that was targeted at this state and cost this state more than any other state. Everyone said it was unfair. Everyone. We sued the federal government. The litigation is still open. Every